Call this meeting of the Codington County Board of Commissioners to order. It is Tuesday, October 12th, 2021. We'll start with the Pledge of Allegiance, and let's have JT lead us this morning.
Yep. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you for that. We'll call for public comment. These are items that are not on the agenda. Well, not a call, I guess we're just going to mention. We'll take them up during the open part of our meeting, and the two numbers that they can call are 882-6248 or 882-6297. Conflicts of interest items. Are there any for fellow commissioners?
No.
All right. Also, we are streaming live, and if your cell phone goes off, if you could step out and take the call, it'd be much appreciated. Item number 4, action to approve the October 12th, 2021 agenda.
So moved.
Second. Oh, sorry.
Got a motion and a second. All in favor, say aye.
Aye.
Opposed? That motion carries. Item number 5, action to approve the October 5th, 2021 minutes of the Codington County Board of Commissioners.
So move. I'll second.
Motion by Johnson, second by Gable, is that?
Yes.
Okay. Any additions or corrections? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. Let's move on then to monthly reports, and we'll start with Cindy.
We are working on several things right now. The budget has been sent to the Department of Revenue, so we're just waiting to hear back from them on approval of that. And then we are working on tax levies and waiting for more information from the Department of Revenue before we can proceed with calculating those levies and applying to property taxes. And then another big project coming up in the next couple months will be the census redistricting, which if there are any boundary lines changed, it will involve my office updating all voter files, and we have to go in and manually adjust those. So that's what we're doing. And I will have 2 employees going to election school next week. It's a school that's put on every other year by the South Dakota Secretary of State. It's just an overview of the elections that are coming up for the year. And I'll be sending 2 employees to that, and you previously approved that travel request. That's
Thank
it.
you. So,
All right. Any questions for Cindy?
Yeah, Madam Chair. Just on the voter, the updates of the voter registration, is that like people updating their addresses or things like that? Or
No, that would be if when they do the census redistricting, any of our boundary lines change, and it
Okay.
might involve a voter no longer
Right.
being in one precinct, they'll be in a different. And I believe there is a public meeting scheduled for here in Watertown for citizens to go and address. These are for the legislative redistricting. There are a number of public meetings across the state this month. I know there's one in Watertown. I just don't know what the date is right now, but if anybody has questions on their proposed legislative district changes, I know they've been on the news stations in,
I think those
in the
dates
state.
are on, they're on the legislative website. And
yeah.
So but the public meetings are. Yeah, thank
So
you.
every 10 years, this is something we go through. If when it gets to our part of the redistricting, First District helps us with it, and we work with the city to make sure that the wards have comparatively close numbers for representation by like the city council and the county commissioners.
The meeting is Wednesday here in Watertown.
It is Wednesday.
And also Sioux Falls. Yeah.
What time is it in
Doesn't
Wednesday?
say here, but
Okay,
doesn't say location, just Wednesday.
okay.
So,
And the rumors are out there that it's going to affect us here in Codington County. They're the city of Watertown,
Maybe not. Yeah, maybe the legislative district.
the legislative,
Yeah.
yeah.
Well, when you look at the map, I don't see it. I had heard once that the city of Watertown may be split into 2 legislative districts, but I don't see that when I looked at the proposed map. So I'm not sure if that came about or not.
We'll see you soon.
Okay,
Thank you.
All right, so that redistricting meeting is tonight, I believe, right? Is that what Troy said?
Wednesday, Brenda.
Oh, it's Wednesday?
Yeah.
Okay, I know it's up at LATC,
okay.
so. All right, there's no other questions. We'll move on then to Welfare Director with Sarah. Good morning, Sarah.
Good
Morning.
morning, thank you. All right, here, I have my report here. I apologize not putting it out last week. There was some things going on, and so I wasn't sure of the updates for that.
Thank you.
There were a couple of things happening that I wanted to make sure I had updated on my report. So first, to start with the services report, that's the graph that is up. Because I didn't come to you in September because that was the week of the state meeting. So just looking at August and September, our numbers are down a bit in September, but you'll notice down at the bottom under the homeless, Q3, our numbers are up there, and those clients have involved a lot of time. And so even though our numbers are down, the intensity is not. And so it's been, it's still taken a lot of time, even though our numbers do look a bit lower. That has involved more staff time. Like that. Yeah, we've been working on getting the stable housing, getting people out of crisis and connected to supportive services. We continue to work with numerous other agencies to provide that support, and our emergency apartment has been utilized literally almost every day since we started using it. And as soon as we have somebody out, we have somebody lined up to go in. The needs have been high, and we've had other people that homeless in the meantime that we've had to work with other agencies.
So, and is that the brothers and sisters behind bars are helping with that kind of, they're watching that and supervising that? Is that?
Yeah, so so that is our partnership with them. Actually, though, everybody that's been in it so far has been through the county.
Okay,
And Brothers and Sisters Behind Bars also has a transitional housing
right,
unit that
right.
they've opened up as well.
Yeah,
And so they've been full of that. So their requirement for Brothers and Sisters is that they have to have drug and alcohol issues and be involved with the legal system.
Okay,
So
yeah, that makes sense. Yeah.
the families that we've been helping haven't met their requirements.
Right, okay.
for that.
So I was just kind of
Yeah.
thinking, I mean, understand how intense it must be, because you want to, you want to kind of, you have to look after the landlord a bit and take, watch the apartment and stuff, so, okay.
Yeah, so we make frequent, like stops there and check it out. Luckily, it's walking distance, so we can just pop over and check on it.
Things are going well with that?
Yes, yeah, they are. Everybody that we've gotten in there has found permanent housing. So that's the.
Yeah, that's the idea.
Yeah, we help get them established. So that's been good. Any other questions about the numbers?
Well, the one area, the energy assistance, I know people need to get active on that, because in visiting with the petroleum vendors, the shortages affect everybody and everything. And they're talking about, they want to know, if there's people that are going to be qualified to be on that, they want to know now,
Yes.
so that they can get them filled up or get them in the system, because they're talking about shortages of LP and all kinds of situations. So just a reminder to make sure that everybody that's eligible and get in and see you folks and get the paperwork going.
Right, and people can apply for energy assistance through our office. You can, utilities, if they receive services through utilities, or ICAP here in Watertown. It's a state-run program, but we have multiple places in Watertown that they can apply for that. So yep, that is definitely something we can assist people with.
Some time of the year.
Yes. A couple other just updates, the CARES, or the ERA, which Carrie's been administering it in August. we received $5,000 for the county for the time that Carrie has spent on that. In September, it was $5,500 for 110 hours worth of time she spent administering the CARES program, helping people with rental and utilities assistance. And so for a total of 172 first round applications as of October 1st. Now, there's been a lot of people that have come back for second and even third round funding, and so those aren't included in that number of it. So ICAP, so there's been a little bit of a change there. Amy worked 34.4 hours in August. However, she accepted a job in Denver. It started in September, and so we don't have an ICAP employee in our office at this time. ICAP is working on hiring for that, but they are not having luck. You know, employee shortage is real. And so they're still working on that. So our contract with them at this point is just kind of on hold. We'd like to keep it as is. And once they get somebody hired,
Right.
we would resume that. But luckily our numbers have been down. So that's been good there too. So we've been able to manage the families that we have worked with. So, okay, and so then in the next section, there's some I want your information, but I'm also presenting some things that for some discussion too before I bring it back for approval. So the first one is just an informational. I attended the summit on building a crisis response continuum in our community. It's a really long title for that conference in August, and with some other community members, with the sheriff and Carrie Johnston from HSA and some other members, police department representatives. And we just need to continue our discussions about how we're going to address the mental health crisis in our community. A lot of that comes from the knowledge that the 988 system will be coming, and how are we going to respond when those calls come through, which are different than the police department responses.
Can you describe sorry, Madam Chair, can you describe the 988, the whole, the concept?
Sure. So the 988, it's an exciting concept. I think it could really change how our society views mental illness. What it is 988 would be for mental health, what 911 is for other emergencies. So 988 would be the call that people make if they are feeling suicidal or they're having a mental health crisis or anything like that. They would dial 988, and there would be some sort of planned response and how we as a community respond to the mental health crisis situations. So that it's starting, pieces of it are starting to be implemented. It should be all in place by next summer. So then
hence the 10-digit dialing.
Yes, that's also the reason
Right.
we have to add the 605.
Right.
And so, you know, South Dakota being the only state that has one area code, we'll have to use 605 for all local calls because of 988 and the implementation for that. So I just got a notification that starting here in the next few months,
24th of October.
that, okay,
Mhm.
next few weeks,
Mhm.
we have to start you dialing 605. So yeah. So that's going to be a change for us here. Yeah. So I also attended the South Dakota Association of County Welfare Officials Conference in Rapid City in September. I was asked to be on that executive committee for that. And so there's 4 members of that. The way it works for the Association of County Welfare Officials is I would start as secretary and then vice president, go to president, and then be past president. That executive committee is really hoping to take things that have been concerns for a long time and finally move forward on them as a state committee with that, addressing some legislative issues and things like that. So that should be an exciting opportunity to be able to bring things together and move it forward to improve services throughout the counties in South Dakota with that. So
Thank you for basically volunteering.
yeah. Well, they called and I considered and decided if my thing was, can it benefit Codington County? And I think we can benefit our county by moving some of those issues forward with that. So that. So the next thing is the Helpline Center Network of Care, which is HCNC, also known 211. So the 211 Helpline Center Network of Care process. They did receive a grant through the Bush Foundation, and they will be working with all of the Watertown social service agencies to implement the software system. I've mentioned it in previous reports and now it's actually happening. So it's very exciting. They have a 3-year grant where they can build this system, and part of that grant, they can build to each agency in the system. So they can build to our needs in Codington County as part of that effort to get us all of this, so the agencies connected. And so that is something I wanted to like mention and have some discussion if you guys have any questions about that. They would like to start with Codington County building for us. And so they sent the contracts. I actually just received them yesterday. I have forwarded them to Tom Burns to make sure that they are all appropriate for the county. But if you guys as commissioners are in agreement with this, they would start building out our system the end of November or early December. They would start building the software system for the county welfare office with that.
Okay, yes, Madam Chair, just ask a couple questions. So will this require more hardware on our part? Is the software that resides on welfare office computers or computers in agencies, or is it web-based?
It's a web-based system, and so it should be all web-based. I can ask them that to make sure. That's part of the reason I wanted to start to have some discussion now before I actually bring it in front of you. So I will ask them about software. They haven't said anything about software. I glanced through it because I just looked at it this morning. At this point, all expenses should be covered for all of the building expenses. Should be covered under the Bush Foundation grant that they received. And then after 3 years, we would have to pay user costs. So those user costs would be the cost per month for each of our staff in here.
So like a per user subscription.
Yeah. So that would be our only cost after 2024.
Because I did I mean, it sounds like a good thing. It really sounds like something that we need, but just want to make sure we eyes wide open.
Yeah.
So if it's totally
clarification, what's the benefit of it? What would we gain? Codington County, what would we gain by it?
I'm very excited about this because it would give us the ability to track what services we're actually providing in a more accurate way, what gaps in services they are. One of the things that their software system does, it will help us identify if somebody calls in and they need housing and we have to turn them away because we don't have housing. Right now, we're not really tracking that. We're just saying like, I'm sorry, we can't provide that service and go do your thing without you. So this software would help identify the gaps in service in our community. It would also make it much easier to track clients that come through over time. Also, for example, right now, if somebody comes in and they were helped 3 or 4 years ago, I have no idea. We can do a search through our database, like our file, do a file search to see if their name comes up. But Carrie and I weren't in the office 3 or 4 years ago. So we have no idea if they've been somebody that's been helped in the past.
So
this software would have a centralized database location where we can track all of that information.
So just to clarify, I think I understand. So you'd have the data for for analysis and understanding the big picture, but also you'd be tracking individuals, kind of like a patient, but so they have to sign a waiver or something.
Right.
And then that, kind of what we've been talking about, the warm handoff. So from agency to agency, so you'd have a way to say, oh, I see you've been to this place, or I see you've been here getting the same help, 6 months ago, or those kinds of things. And so, then that for the individual, you can dig into another issue. Maybe it's them, or maybe it's something else. So that sounds exciting, especially if it's not going to cost us anything per month. So
Yeah.
Right. Yeah. And that is, so like we have the immediate or the support here in our office locally, just with us individually at the county welfare office. It will be a huge help for us to actually have a software system that we can use similar to most other social service agencies. On a bigger picture, it's going to help our community because it will get us all connected, all the social service agencies connected throughout our community with that. So that's the big picture piece of it.
Thank you.
Yeah, are there other questions or concerns? Like I said, I will be coming back with that contract once the attorneys approve it.
If there's any meetings, I'd be, that if I would be interested in attending.
Okay.
Just if the timing works out, or
Sure.
perhaps Commissioner Johnson as liaison might want to do that too. I don't know. So, but just kind of what I'm interested in always with, you know, the interface, if somebody gets out of the jail, kind of the transitional stuff that Commissioner Hanton was working on. How do people, you know, you know, if this kind of stuff works, it can, you know, maybe shave off a little bit of the recidivism too. So that's kind of exciting.
What's the name of the program, the official name?
So it's a Helpline Center Network of Care.
That's what it is, network of care.
Yeah. And so then this grant that they received is to assist Watertown and Brookings in expanding and connecting our social service agencies. Not expanding them, but connecting them. So expanding the software. So that's that. Yeah. So again, I'll be back with that contract. And there won't be any costs associated unless I'll double check on the hardware, but I think it's all web-based, so there shouldn't be hardware, but I'll double check on that. Okay, the next one is also a piece to hopefully reduce some of that recidivism. The South Dakota Department of Health grant, this is another one I wanted to mention if there's any questions or concerns. I will be coming back for approval for this. The Department of Health has received a bunch of money through the federal government. When I say a bunch, like a lot of money through the state. One of the pieces that they're doing with that is expanding the community health worker systems. They were supposed to have the grant proposals or the grants out. It was supposed to be out last week. And that was one of the things I was waiting on. That hasn't been released yet for the grant proposals. But what I would like to do, and Leah and Commissioner Gable and Brad and I had all attended an informational session about this. And one of the things that we could do is the idea behind it is to hire a community health worker through one of these grants with the goal that they would kind of target the high utilizers through the jail system and the legal system to track them and follow them, make sure that they're connected to the services that they need to be connected with. And then utilizing the right services, especially the mental health services, because that's typically what we see is those high recidivism rates are connected to mental health issues. And so this employee would work with both people in the jail, but also my vision of that is also potentially with the state's attorney and people that she's seeing, so that we can help people get to court appointments when they need, or get to court, get to mental health appointments, all those types of things, just to really hold their hand better to get people through the system and with the idea that they work out of the system.
Can I, if I can, Madam Chair, if I can expand on that. So the reason I was there was I still worked at LATI, so I just happened to kind of be there. And this is, or LATC rather. So this program started with the community health care worker program at LATC, where Heidi Wirtjes is kind of coordinating it in the community. I think that's basically how it's working. And so the idea is what a community healthcare worker is there's some aspects kind of like a medical assistant there. There's aspects of some social work there and understanding how the system all fits together. So, and it's especially, I guess other states are seeing that this is a useful thing. And so that's why the Department of Health is trying to encourage this. So is that
yeah, thank you for that clarification. It's one of those areas where South Dakota is joining the game a little bit late. I think we're one of the only states not to have community health workers pretty extensively across the state. And so they have a goal of having 200 community health workers across the state in the next few years. And that's why they have, or maybe it's even, maybe the grant, there's 200 grants for that, but they have a goal of actually much higher than that. So they're going to have $250,000 grants, and I would like Codington County to apply for one. It's a 1-year grant with the potential to apply again for a second year for that. And we would have to make sure that they go through the community health, that they become a certified community health worker in that. And so we could work with LATC to make sure that they get certified.
So yeah, it's a shorter program than the full associate's degree, but the idea is that it's very targeted at what needs to be done. So
any questions about the community health worker grant piece of it? Again, once that gets released, then I will be coming back for permission to apply for one of those grants. Okay, then just some other updates for office space, looking at, we really could use more space with everything that's happening. However, given all of the uncertainty, I'm not really sure where to go with that. And so I think it's just a long-term process. I did explore a couple options. You had mentioned, or was there a landlord?
Yeah, I can
Okay.
talk about that. Yeah, Myron and I looked at a few offices. This is like a year or so ago when we were
Okay.
thinking about it, but I mean, it's kind of a bigger discussion,
Yeah,
but because there is a lot of convenience in being so close to the courthouse, and so yeah.
I really like our space. Our space just is, we're gonna outgrow it. And so I wish, and that we did look at remodeling expenses, and that's pretty high right now. It's a city building.
Yeah.
And so that wouldn't be something that I would be supportive of the county investing all of that money into. So, so that's where that's at. We are also meeting with A&B Business to discuss a program to scan files. It's the same thing as what the auditor's office uses. And so our hope is that we can get our files scanned onto the computer. So again, that we can do an easier search for old files. We have 7 file cabinets in our office, and I'd like to get those digital so that we can free up some office space for that.
One of those files, we have room for another person.
Exactly. We literally would. So that's part of it. Yeah. Yep. We would have room for a desk there. Okay. And then, so for the systems of care piece, we have our interagency meeting this coming Thursday. Typically at that meeting, we do discuss community services programs that can be provided. Last month, we actually presented on the energy assistance. However, every month I'm like, we're going to have time to talk about what's going on in our community, and every month we run out of time. So this month there's nothing else scheduled. 211 is going to talk about, or the Helpline Center is going to talk about their program, and we're going to just update on what's going on with the community. Resilient Community, Codington County is moving forward, which is a very exciting. Tomorrow is our stakeholder meeting for that. And so that is, community leaders have all been invited to the stakeholder meeting so that we can move us into the next step of becoming a resilient community. It really addresses childhood maltreatment and its impact across the lifespan. It's really fascinating information. It talks about adverse childhood experiences. Also, that's ACEs for short. One of the things that's fascinating about it is it talks about how experiences as children affect people as adults, from the legal system to the healthcare system and all of that, things that you wouldn't think are related. Experiencing physical abuse as a child can lead to heart disease as an adult, or is directly associated with it. So it's very interesting, and we'd like to reduce that happening in our community through the resilient communities. All of you are invited to the stakeholder meeting tomorrow. So if you are able to come, please let me know and we'll get you on the list. It's at 11 o'clock at 2nd Street Station. And there will be a light meal served and then some information about that. And again, we sent out invitations and we've done some follow-up with that as well. Then the next step will be to do some community trainings regarding the ACEs with that and moving forward, identifying needs. We're also working on a social services strategic planning process. And so that piece is in the works as well. And then the final is our community service highlight. In the past, I've highlighted more of a family, but I really want to move it towards more of how our services are working together around families or around individuals. And so in this situation, we had a single mother with 2 children. She'd been homeless for over 3 years. Our office assisted in coordinating services, which included ICAP, Access Ministries, Costello Property Management, Watertown Transit, HSA, Department of Labor, the school district, Sanford Health, Brown Clinic, and Social Security. They now have their own apartment and they are working on addressing their financial, mental health, and medical needs. The case management support provided by our office is ongoing, with the goal that they will be connected to appropriate services for long-term support that will be able to back out, and those other agencies will be able to help them. But you can see, I think that's a good example of how one family needs so many services and they're functioning in crisis and can't manage that. So they need some case management to help coordinate all of those services. So, and that's the goal of the system of care.
Good report.
Thank you.
Any other questions?
All right, anyone else have any questions? Hearing none, thank you, Sarah.
Thank you.
Thank you, sir.
Thank you.
All right, let's move on to item number 7, action to approve the auditor's account with treasurer and notes monthly register of deeds fees.
The monthly register of deeds fees were $43,719.40 in the month of September. And then the auditor's account shows the account and the cash and cash items on hand as of the last day of September. The second page shows you where our cash fund balances are.
Move to approve.
Second.
All right, we have a motion and a second. Any other questions? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. Item number 8, action to adopt a resolution to cancel outdated checks and send funds to the office of the South Dakota State Treasurer. Cindy, you must have that information for us.
I do. This is an annual resolution prepared by the treasurer. She has tried to contact these people who have outstanding checks that were issued by the county. They range in amounts from, looks like $3. No, it looks like from $1 to $162, which is the average for what we deal with each year. And we've tried to contact these people. We can't get a hold of them to find out why they did not cash the check. So by law, we have to turn this money over to the state of South Dakota, and then it goes into the treasurer of South Dakota, the unclaimed property, where they also advertise a list once or twice a year for people to reclaim their unclaimed funds. So we just need to pass a resolution to do that.
So it says on this draft, I'm supposed to make the motion and it's on the draft.
What?
It already has the motion and the second on.
Oh. That can be changed.
Okay.
I don't.
Just
So
to
moved.
stir. Okay, then I'll
make the
second.
change it.
Then I'll second.
Okay.
Johnson made the motion, Gable seconded it. Yeah, I was kind of surprised to see UPS on this.
Yeah, we've tried contacting them. We think it was a motor vehicle refund, but a lot of these are, to me, look like jury fees, $10, $20, or some kind of refund from the treasurer's office, so.
Right, and so these people now, like if you would have known them, you would have had to do it before this time, or how long?
Yes, yep, we are past the date where they can come in, so they will have to get their money from the state.
Okay, sounds good. Any other questions or comments for Cindy? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. Item number 9, actions to approve revisions to the COVID policies. Is Natalie able to come up and explain what
she's
changes?
Hello, I'm here, Brenda. Good morning.
Good morning.
All right, do you need copies, commissioners, of this?
I thought you were gonna.
I know. You gave them?
I gave them just the red part.
Yeah, perfect.
Okay.
Yep,
All
thank you,
right.
Cindy.
I thought
Okay.
we'd be here all week.
I know. Nope, we're not gonna tackle the whole thing, the whole manual today. We're just gonna tackle the COVID part. So, starting on page 50 is where we're at. And so part of this is, we need to remove sections that are no longer applicable. There's things in there from 2020 that we put into place when this all first started to reduce presence in the courthouse, and some of that leave that you had given people at that time. And then in addition, when the emergency paid sick leave part went into effect, then we added language around that. And so those things just need to be pulled and removed. So starting on page 50, I've just redlined through. I think we need to eliminate letter K, as that's no longer applicable. And then on page 51, I just added a sentence that, or the section on the top that we're going to revise this effective today's date, and updating the policy in response to the ever-changing information surrounding COVID. And then redlined through pretty much that whole page 51, which was all about reducing presence, the physical presence in the county facilities and how that would be handled, which we do not need to do anymore, thank goodness. And then the leave that was given again as part of the emergency sick leave and all of that, red line through most of 52. So I think the sections we need to leave in is and revise is on the bottom of 52, employee receives positive test for COVID-19. This per CDC guidelines has been changed from 14 days was initially what CDC required, and now they have changed it down to 10 days for quarantine/isolation. And I've tried to use that word, just put them both in there, take it off. As Lee pointed out, it can be confusing. Isolation is if you have it, quarantine is if you're exposed. But anyway, so that's kind of how I have done that, or my suggestion on that. And then 53, if they are experiencing symptoms and advised to quarantine or isolate while they're awaiting results, and what we do there.
That's similar to if they test positive.
Yep.
Yeah, that's basically what their healthcare professional says. The provider
Right.
Says, yeah.
Follow the
Right.
guidelines.
And then the next section is the other situation that we still deal with is what if you're a close contact? So we know that our employees are considered essential services. So how we handle close contacts within the county might be different than some private entities that are not considered essential services. But basically, if they are a close contact, they would still be expected to report to work. They should self-monitor for symptoms and practice social distancing where possible. And then we put, per Commissioner Gable's suggestion, some differences for what if you've been vaccinated or unvaccinated or had a previous infection or haven't had a previous infection. So you can read through the language that was added regarding that, which would basically be regarding masking or not masking. And what if you become symptomatic, then what should you read? What should you do? There was a section about temp checking as well in here, which we have removed. I think that we found temp checking not to be very consistent or always accurate. So with depending on what thermometer you're using. So
I make a motion to adopt these changes.
Second.
Brenda, there's a motion and a second on the floor.
All righty. So is there any other comments or questions? Hearing none, all in favor say aye.
Aye.
all right, thank you.
Thank
I will
you.
get that distributed to staff.
It's always
All right.
revolving.
Thanks, Natalie. All right, let's move on then to item number 10. Discussion, possible action to participate in hiring Ike Bailey as a consultant for ARTA spending guidance. So, I don't know, Cindy, do you have some information? It's just the.
Basically, Chris is saying you guys discussed this at conference. Is that correct?
Yeah, so this is a statewide effort to try to make it affordable to hire a consultant that we would all share. And then we will use our planning district to submit our questions on which projects are eligible or not. And then they will contact Ike Bailey so that it's not, you know, everybody asking the same question, because maybe some have already asked it and Ike Bailey may already have that answer. I know that Ike Bailey is also doing this in other states, so we'll have that information as well as
I do have one short paragraph that I could read to you from the email that came with it.
yep.
The South Dakota Association of County Commissioners has engaged with Ike Bailey to provide consulting services regarding the use of the American Rescue Plan Act funds, and they believe that the cost of this service would be covered under the allowable ARPA regulations. So the cost to the county would be $2,000, and basically we're hiring Ike Bailey along with a number of other counties in the state to guide us through the process of spending the ARPA funds.
Madam Chair, if I could make a comment, just I like the idea of sharing the cost. It makes a lot of sense, especially if they're, and then in a way, we're kind of sharing the cost with counties and other states. That's all a good idea. I'm pretty sure that this is, you can use the ARP funding for this particular expense. It's only $2,000 in our
And
case.
that's what that last line of that.
Yeah,
Yep.
and I'm pretty sure they, when it's one of the webinars I listened to, they said that. The only thing is I know we've discussed this at the state level among the County Commissioners Association. Is there some kind of a proposal, or, you know, it doesn't have to be a long thing, I think, for my Bailey, what their consulting background is. So that's the only thing, that's the only question I have. I generally like it. Makes sense. Could make this a little bit easier to figure out, so that we're not confronted with surprises later on after we've expended these funds. So I don't know, you know, Madam Chair, if you know, or Cindy, if you've seen any kind of a proposal or something.
I have not seen anything.
I don't know if they ever did an RFP for this. Bailey has just been doing it with other states, and so Chris had knowledge of that through the association. So I guess that's something you maybe would have to ask Chris for, if, you know.
Guessing the association has the details surrounding that agreement.
Eide Bailey was the firm that was used on that first round of money that we received. Everything had to be checked by them before it was sent to the state for reimbursement. So they did help us once before.
Yeah. Okay. That was the CARES. Was that the CARES stuff? Okay.
Yes. Yep.
All right.
And Eide Bailey is a very reputable organization. So
that makes me feel better.
I feel comfortable in making the motion to go ahead with it.
Second.
All right, we have a motion. Do we have a second?
Second by Van Duzen.
Okay, very good. Any other questions or comments? I guess, Lee, I would just say, if you have some questions, reach out to Chris, and maybe she can give you the information that you're looking for.
Yeah, I sent Cindy reminded us that they worked with the counties on CARES money that assuages most of my concern. So.
Okay. All right. Any other comments or questions? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. Move on to item number 11, action to approve a change order for the bridge rehab project, 15-240-155. Rick is there, I'm assuming, this morning.
Good morning, Brenda.
Good morning, Rick.
This is a $27 change order on the bridge east of town on County Road 75. There was a difference in rebar or something, the price when it was bid, so.
I'll make a motion to approve this change order for
And this is an increase, correct?
Correct.
$27.
Second.
All right, we have a motion and a second. Nice to see it's not a big amount, just formality at this point. Any other questions, comments? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. Also, this would be your item number 12, action to accept a proposal for engineering services for estimation of riprap along 442nd Avenue.
This is where we did a grade raise on County Road 20-4. We're approximately 4 feet out of the water, and it's roughly 1,800 feet, maybe a little more or less, both ways. And this is to get it riprap, and the water is roughly between that 8 and 10 feet deep there. So we need to get it done. It's standing alone right now. And this is just to give us the quantity of riprap that we're going to need, and then we'll have a notice to bidders when we get this.
I'll make a motion.
And this is for cost of $2,000, correct?
Correct.
Okay.
I'll make a motion to accept this proposal.
All right. We have a motion. Who made the second?
Waterman.
All right, very good. Any other questions or comments? Hearing none, all in favor say aye.
Aye.
Opposed? That motion carries. So Rick, after our rains this weekend, I know I had 3 inches here. I'm sure the water on the west side, is that starting to kind of creep in?
I couldn't really give you an answer to that right now because everything was still running. So, and I'm not sure what they got on that side, but I'm sure they got about the same. So,
Right. I was just curious if you noticed anything, so.
no, I was out there before the rains and I haven't been out there since. I'll be out there today sometime. So,
All right.
Take your hip boots with you.
yeah, we need to quit asking for more rain. So we've had enough.
Yeah,
Is there any washouts?
I'm just
or
glad,
anything?
I'm really glad that
Haven't
that
heard
bridge,
anything.
Okay.
So,
I'm glad that the bridge on that, whatever road that was closed. I'm glad that that was able to get completed, so,
yep, that was on 7-5 east of town.
yeah.
Thank you, Rick.
Thank you.
All right, thank you. All right, this would be Jamie. We'll move on to item number 13, action to adopt a hazmat plan for Codington County.
Good morning.
Morning, Jamie.
So in summary, this is a federal, state, and local response plan in a nutshell. Very large, 191 pages, about 40 pages of it are the actual documentation of bylaws and things for on our local levels on basically resource and logistics.
You don't need to read it to us.
You don't want 190 pages. Yeah.
Good.
A very large document that names primary and secondary people in all these industry and what have you, as far as state DNR or Ag and South Dakota Department of Ag and Natural Resources is concerned for requirement training things. So federal funding, First District has developed this plan over basically since I started. I applied for this way back then in 2020, and now it's completed. It's a 5-year plan, renewed. We go through it once a year at our quarterly meetings that are at LEPCs. And that's what this document does, is names all those contacts, resource, logistics, including shelters, what have you, place we have a response of an incident of a hazardous material release. And the last half of this whole thing is all the mapping and locations for our responders. That is a document that's in my office, the fire departments, and then I believe the towns get their certain section of this plan as well. So.
If, question, Madam Chair. So if this, say if there's a change in a point of contact or a map needs to be added or changed in there
Annually.
So we do, so this is what's the difference between this and last year? Is there any difference between this year?
This is a fresh updated 5-year.
That's fresh.
So this
updated
is
5 year.
identified, so every 5 years, we
Okay,
go through.
all right.
And First District actually went with her to probably about 25 sites and got in pictures of new industry that's in town. Like,
Okay,
say Terex.
Right.
Made that big move.
Mhm.
So we go out and update that plan and identify where, but they also report to the state as well.
right.
And then that's how we kind of get notified and updated on
Okay.
those certain things.
So the annual updates, those don't come before the board, or they do?
I'm trying to remember if they do or not. So do we annually sign off that we've updated? We've reviewed
I'm
it.
trying to
I think
remember
so,
myself.
yeah. We up,
It's
yeah,
more on
like
the
there are no
LEPC.
changes, but we do, I think I'll have to look back.
Because I remember
we
doing
do.
this.
Not
just don't remember how
positive, yeah.
frequently we've done it. So,
Yeah.
okay.
It's reviewed every year if there is.
And notice that, and we note that if there are or are not changes, I
Right.
think.
So other than points of contact, maps and locations and those kinds of things being updated, are there changes between this plan and the last 5-year plan? that are
Yeah, there's a few
significant?
new industries that have been added that added.
Okay, so
quite a few days,
just, okay,
Very
all right.
much updated plan.
right, okay.
A lot of the wording remains the same as far as the state, they've changed their names. It's still Department of Natural Environment Resources to me, but now you've got agriculture because they combined. But so that's all the Title 3 reporting that's required by the government for meeting. You exceed those thresholds of hazardous quantities. That's what this document really is. It's a lot of reporting what they store, where it's at.
Okay.
And then in time of response, we grab this book, the fire department has it. It's a book of knowledge as far as.
It's effectively a database of,
Correct.
yeah. All right. I'll make a motion to adopt this.
I'll second it.
Once you do that, then I take and we'll adopt it on the LEPC at our next meeting. in November,
Okay.
And then it'll officially,
Is 911 center given a copy of that?
they probably should be.
Yeah.
All right, so we have a motion and a second, right?
Correct.
I was hearing that, okay. Still discussion, that's fine,
What was that?
everyone.
No
I
discussion.
just said, yeah, still open for discussion, unless everyone's good, we can go ahead and vote on it. All in favor, say aye.
Aye.
Aye. Opposed? That motion carries. All right, thanks, Jamie.
Thank you.
Item number 14, action to approve claims for payment. Can Cindy sent that out?
Total claims for the county were $4,598,493.48. Claims to the state that are passed through, $598,686.62. The large amount for the county is directly due to the amount that we paid Dunick $3,849,023.95, and that is for the Hall Road restoration project. So we have been given these funds, and now we can do an automatic supplement to the highway budget. And then we also had a large bill for $242,690.80 to Prom Construction, and I think that was for a bridge project that we completed. And other than that, there's not too much. You can see on page 5, government buildings budget, we paid $29,534.75 to Advance Concrete, and that is for the courthouse parking lot project. I don't know if that's just for the concrete or the whole thing. It might just be for the concrete portion.
That curb and gutter and sidewalk down there on the south
Okay.
side of the parking lot, which is,
Also, yep, okay. Also on page 8, we paid Midwest Pipelining $103,974.68. And that was for the sewer project at the detention center. That is the amount that they bid on the project that we accepted down to the penny.
that's the total price, right?
Correct.
Yep.
That would be the total
Okay.
bid price, yes.
Mhm.
That job isn't completed yet, though.
Yeah, I think it is.
Is it done
I
now?
believe it is done. I think they finished up last week sometime. And then on page 12, we received $5,000 from the Watertown Community Foundation for pod expense, mass vaccination expenses. And after we paid all the expenses we had, this is the amount that was left that we returned to the Watertown Community Foundation, or the agreement when we got the funds that we would return anything we did not use. So
Make a motion to approve.
Second.
All right, we have a motion and a second. Any questions for Cindy? Hearing none, all in favor, say aye.
Aye.
Opposed, that motion carries. All right, we'll move on to item number 15, action to approve automatic budget supplement.
So we have 2 today. The first one is in the amount of $3,849,023.95. And that is for the Hall Road restoration project. We can put those funds back into the highway budget because it was an unanticipated project. And the second amount is to the emergency management budget for $8,044.50. That was an SLA project for electronic equipment updates to the EOC. We can also put that back into their budget.
Make a motion to approve.
Second.
All right, we have a motion and a second. Any other comments or questions?
Jamie, what updates?
That actually was 10 new computers against the one was 10,
Okay,
and then a new monitor
okay.
screen. What that was is state office of emergency management special office. This, but
Perfect. Good.
Thank you.
All right. Any other questions? Hearing none, all in favor, say aye.
Aye.
Opposed? That motion carries. Item number 16, action to approve personnel changes.
There are no personnel changes today.
All right. Item number 17, action to approve travel requests.
We have a number of those. The office staff from the community health office is requesting to attend a DENR conference, NetSmart billing training for electronic health records training, and that is here in Watertown, but because it will take them out of the office, we need to approve for them to attend that. Then we have the Weed and Pest Department. We have Mr. Mollengrath and other, let's see.
That's also
All
here in
sorts of
town.
stuff.
South Dakota Park and Rec Conference.
Yeah, there's a number of them.
Registration.
Actually, the one that
Oh.
Steve is attending today is in town here at the Watertown Events Center, which runs for, it looks like today, tomorrow, and Thursday. Memorial Park, the facilities manager to attend the 2021 South Dakota Showcase in Sioux Falls. Facility, or the Weed and Pests Facilities Manager to attend the Weed District meeting along with one of the part-time sprayers, and that is in Redfield. And then I'm not sure, this is kind of messed up here.
Steve and Ron both.
Right, but they're different dates. I guess Steve's meeting is in Rapid City and Pierre.
Yeah, Cindy, they have those district meetings on
Okay.
different days, so.
Okay,
yeah,
yep. And then another Weed and District meeting in Redfield for both Ron and Steve. And let's see, the Joint Safety and Loss Training Conference for Steve Mollengrath and Rick Hartley.
Move to approve.
Second.
All right, motion by Johnson, second by Walkman. Any questions, comments? Hearing none, all in favor, say aye.
Aye.
Opposed, that motion carries. All right, item number 18, public notices, possible quorum of commissioners. We have one listed, Farmers Business and Banquet, November 18th at 5:30 at Studio 212, the former Shopko building. I don't know if any of you signed up for the legislative banquet that's coming up October 18th, which is Monday night in Webster. That's all I have. Does anyone else have anything?
But there was a thing that Sarah mentioned with the, I can't make it, but the one on tomorrow with the, I forget the name of it, with the Resilient Communities meeting.
Yeah,
That's
I'm signed up for that, actually.
That's at Second Street
I don't know
Station.
if I'll be going though.
Yeah.
But yes, that's tomorrow at what, 11:30, I believe.
Yeah, on Second Street Station, she said for that.
Yeah. Or 11 o'clock. Okay, anything else that I have missed?
Nope.
Hearing none. Item number 18, old business. Do you have any old business?
Did everyone get the message that the new software that the treasurer's office was gonna take care of has been, the state has moved that to the spring of 2022 to roll out instead of after Thanksgiving?
Yeah,
Okay.
that would be good, I guess. Give them a little more time. Hopefully it will go smoothly. All right, item number 20, any new business? Do we have new business? How about for the open? Yeah, for the open, do we have a need for executive session?
Nope.
Move to adjourn.
All right, motion by Johnson,
Second.
second by Gable to adjourn. All in favor, say aye.
Aye.
Opposed, that motion carries. We are adjourned.
Thank you.